Welcome back to the Next Appraisal Tool modules. In this module, we will be discussing question number 24. Are major limitations of the study clearly described, including their effect on the results and implications? This includes the bullet points of, do the authors describe quantitative limitations with examples listed, qualitative limitations with common examples listed, lack of fidelity to the study protocol, and or strategies to minimize these limitations. Authors will typically provide this type of information in the discussion section of an article. Hopefully you remember the statement made in an earlier module that there is no perfect study. Researchers must make design choices, sampling decisions, measurement decisions, all in putting their study together. Most of these decisions are a choice of balances. How much control is added into a study versus allowing things to occur naturally? The tighter the control that's introduced, the higher the risk that the results might not reflect the natural reality. Thus, because of how these decisions are made, every study has limitations. Limitations of a study may be loosely defined as those characteristics of design or methodology that impact or influence the interpretation of the findings. Typically, there are a few statements towards the end of an article where the authors identify the study's limitations. The list may not be exhaustive, but instead are the ones the authors might feel need to be mentioned. As a reader, with continued practice and experience reading reports of primary research, you will begin to think of these even as you are reading through the methods section and not solely rely on the author to identify them for you. But for now, the intent of this appraisal question is for you to look to see if the author provides some discussion about the limitations and how these limitations may have influenced the results. Here is an example from a published article. In this example, the authors identify limitations related to not using an experimental design, thus lacking random sampling, so reflective of setting and sampling choices made. There were also differences between the multiple settings used, related to staff shortages in one of the settings that likely impacted the results. They also describe a lack of measuring long-term infant and maternal well-being, so choices made for measurement. Lastly, they identified that the researchers weren't blinded to the intervention groups, thus a potential risk for bias. The authors clearly identify some limitations for the readers, and if we were to read further in the study, we would find the discussion on how the authors feel these limitations impacted the study's results. In forming your appraisal response, decide if you feel the authors provide an explicit description of some of the study's limitations. Remember, from a quantitative perspective, common ones include sample size, lack of randomization or comparison group, and or measurement issues. While qualitative limitations often involve lack of data saturation, lack of a trail audit, or interviewer bias. Additionally, have the authors discuss the potential impact or strategies to minimize these limitations. Congratulations, you have successfully completed this module. You may return to the main menu or continue to other appraisal modules in the next EBP course.